Hi, I'm Dr. Brian Young, a naturopathic doctor here in Toronto. We'll be presenting a series of weight loss tips here on this channel, so subscribe if you're interested in learning more. Weight retention after pregnancy is something that might seem inevitable to a lot of expectant mothers. Slimming down to your pre-pregnancy weight is not actually as difficult as it may seem. Let's find out how. Setting yourself up for successful weight loss after pregnancy starts during pregnancy. Let's start with our first 2 tips during pregnancy. 1. Weight gain is normal. Understand that some weight gain during pregnancy is unavoidable. The amount you should typically gain depends on your weight going into pregnancy, as well as if you're expecting twins or not. I'll link a resource to average weight gains during pregnancy down below, but to give you an idea, a healthy woman with an average weight should expect to gain anywhere from 25 to 35 pounds during pregnancy. Much of this is the baby and the baby's home. Things like the placenta, uterus, amniotic fluid, and extra protein, water, and fat. For someone going into pregnancy overweight, weight gain is still expected, although not as much. Closer to 10 to 15 pounds during the course of pregnancy. You shouldn't be looking to actively lose weight, nor is it recommended you partake in heavy dietary restrictions during pregnancy. Your nutritional intake during these times will affect the health of your developing baby, and your baby will need all the nutrition it can get. 2. Focus on healthy eating. Just because you shouldn't be overly worried about trying to maintain your figure during pregnancy doesn't mean you should eat whatever you want, whenever you want. Rather than calorie restriction, the focus should be on a balanced and healthy diet. For example, for an overweight pregnant mother, I would recommend the more balanced Mediterranean-style diet, rather than, say, the ketogenic diet. You may have heard the saying, "I'm eating for 2." Don't take the phrase literally. Although your calorie intake is expected to rise throughout your pregnancy, you likely should not require enough for 2 people, which would be like well over 3,000 kilocalories per day. That'd be too much. Now let's take a look at 2 tips after pregnancy. 1. Focus on the weight loss after pregnancy. Studies show the actual weight retained shortly after pregnancy is relatively small, around 1 to 5 pounds. Studies that look at weight gain 1 to 2 years after pregnancy show more significant gains in high-risk mothers, anywhere from 10 to 50 pounds. This suggests that most of the weight gain and retained occur in the many months and years after pregnancy, not during pregnancy. Most of the weight gain during pregnancy is lost shortly after pregnancy. My experience with weight loss patients really reflect this, as new mothers often do not have the time or energy to focus on their diet. And by the time they do years later, their weight has already steadily risen. Have a dietary plan ready to go after pregnancy. Whether you decide to go low carbohydrate or whatever, know that you'll have to start watching what you eat as soon as possible after giving birth, if you want to minimize weight gain down the road. Keep in mind that if you plan to breastfeed, having sufficient nutrition will be important to maintaining a good quality milk supply. So prolonged fasting or rapid weight loss diets are not recommended. I suggest a more gradual weight loss protocol with the goal to lose something like 1 pound per week. 2. Get support. If you're fortunate enough to have relatives or other individuals that are willing to help you during and after your pregnancy, let them know of your efforts to keep your weight under control following your pregnancy. Let them know the diet you plan to follow, and ask them to keep you accountable, or even provide those types of meals. Let me know in the comments down below about what you think, and if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss tips in this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.